everyone. The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin and practice in this wonderful state of Queensland, they volunteered their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and meant for information and education only. Please note, this is no substitute for your own healthcare professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary-General of IMA Queensland, Dr. Cyril Fernandez, to introduce to you our guest speaker of this month.
Welcome to another episode of Aapki Sehat, Your Health, conducted by the Doctors of Indian Medical Association of Queensland. Today we have Dr. Pallavi Bansal, a rehabilitation medicine physician, with us. Welcome, Dr. Pallavi.
Thank you for having me here, Abha and Cyril. It's a pleasure to come to this platform and talk about rehab.
Thank you.
Hello, Pallavi. I'll start by asking a simple question to you. Tell us, us and the viewers, something about you, your journey, life journey as a doctor in India and Australia, educational qualifications, professional experience. We know that you have immense experience, teaching experience, learning, so many things. Please tell us and guide us. Thank you.
So I did my undergraduate from University of Rajasthan and came to Australia, and I've worked across various places, including Hobart and Brisbane. I've been trained across both multiple sites, including public and private. That has given me a variety of experience. So apart from my clinical role, and I work as a rehabilitation specialist, a rehabilitation medicine physician, as you would like to call, currently at Brighton campus. And within Metro North, I also run clinics out of Redcliffe Hospital. Prior to that, I was working at Gold Coast University Hospital and Robina Hospital, doing inpatient rehab, something we call, it's a distinct part of rehab called in-reach rehab, as well as running outpatient clinics. I have been director of clinical training at Gold Coast, and I moved to Metro North last year, and I've been in the similar role, director of clinical training here as well. I've been an examiner both with RACP at fellowship level. I've written some questions for RACP as well, so I'm a frequent writer of examination questions, and have been a mentor of medical students, being adjunct assistant professor with Faculty of Health Sciences, Bond University. I love to teach because as clinicians, I think it's very imperative that we develop our clinical growth as well as, we mentor our medical students at various levels to, get the right people into medicine at the right time.
Pallavi, I understand that you have wide clinical experience in the field of rehabilitation medicine and teaching medicine, teaching the newer generation, and that your husband is a good general practitioner, Dr. Sukesh Bansal. Can you highlight more or tell us more? Viewers would like to know more about your area of specialty rehabilitation medicine, like what is around it, medical conditions and scenarios,
For viewers, I like to put it in simple words.
Yes, please.
So when they have to go to hospital for any, say, acute medical condition or surgical condition, they have a surgery, and they're treated by acute physicians, our colleagues. Definitely, they save lives, and I have a deep gratitude for what they do. But rehabilitation makes that life worthwhile. So you would be surprised to hear when people are in bed, be in ICU or in medical bed, even for 1 week, not able to do anything, you actually lose 40%, up to 40% of your muscle mass. You may lose 1% of your bone mass in a week. So that's how deconditioned people become. Yeah. And that's where I step in as coordinator of rehabilitation medicine. So what we try to do, I think that rehabilitation needs to start from day second or even day one of their journey. And as it is, I think sometimes we have been on the other side, and it's not easy to be in hospital, and especially when you get deconditioned. And some things that, we take for granted, for example, showering, Dressing oneself or undressing, just simple sit to stand or get out of the bed may become very difficult, particularly for elderly population after they've had a surgery or had a medical issue. So they need restoration of their function, either back to normal or be as independent as possible, and that's where my role steps in. So it needs a multidisciplinary assessment. It needs an assessment of the physical function, the cognitive function, the psychiatric function. It needs a holistic approach to get them where they are. Sometimes it's not possible, and then we have to, rather than have a restorative cap on, you have to think, what's the best outcome? Where's a safe environment that these people can move to? And you facilitate all of that.
So the aim is to restore them, rehabilitate them to maintain a good quality of life. So what all things are involved in this, proceedings, procedures, and teamwork?
So I would like to use an example. I think that
please.
might be easy. So I've had patients, and sometimes it's very sad to see young patients with stroke. So I'd like to take an example, say a 48-year-old person with a stroke who has had body impairments, so they're not able to speak, swallow, not able to move an arm or leg. So that's where their body impairments are. Now that translates into certain functions that they might have lost. For example, as I said, not able to walk even 10 meters or 20 meters, not able to speak or communicate with family members. They might have young children, teenage children, and then they may have a role within their household as a dad or mom that they need to live up to. And then extending it further, they might be working as an IT consultant or say a musician who needs to play instruments, but they've just had a loss of arm or leg, right? So you need to work on that loss of body impairment, make that arm move, make that leg move, enable them to speak, restore their swallow, do various assessments, and then treat it and get their function back to normal. But at the same time, they need to return to that community. So what do? They also need rehab to go back to, say, what they're studying, go back to their work environment, whether their desk needs to be modified.
So there are allied health involved, physiotherapy,
Absolutely.
occupational therapy, speech therapy,
Yes.
and some Botox injections you do as well?
Yeah, I would like to say I do have special interest in hypertonicity management. Neuro rehab is my passion.
But I'm sure that was something Abba wanted to ask you more.
Sure. I'm also passionate about falls and balance prevention, and I used to do a special clinic with falls and balance prevention, particularly in elderly population while I was at Gold Coast Hospital. The other thing, I'm from Jaipur, and you may have heard about Jaipur Foot. So it's been, I think, pioneer in amputee rehabilitation and played very pivotal role in establishing, what amputee rehabilitation is. And we have had war veterans, we have had young people, from leg infections or trauma or diabetes who might have lost a leg or an arm and require a prosthesis. So they go through stages of rehab as well. So these particular areas really interest me, and
so
I do
are
learn it.
biomedical people also involved with your branch of medicine?
Not so much, but like I use an ultrasound machine for my hypertonicity management. So sometimes you deal partly with that, but it's mainly multidisciplinary. And I know artificial intelligence is coming in every way possible. So we do use artificial intelligence in neurorehabilitation, robotics, particularly. So that's very useful, particularly for longer outcomes, after they moved in community.
And that must be getting better by the day as the artificial intelligence, also the technology is getting more and more advanced.
Definitely, and there's more evidence to support it as well.
And also very satisfying as a doctor for cases where otherwise the person's fit and healthy and has met with a car accident and a sudden unexpected loss of significant function because of loss of a limb. to be able to restore that function for
Absolutely.
them.
Absolutely,
It,
absolutely.
it would be a great outcome for everyone, for the patient, for the community, for the family as well.
Absolutely, and I think we just don't treat the patient, I think we treat the family as well. They're part of rehab journey as well for that particular person.
Yes.
Yeah.
So children with cerebral palsy, spasticity, do you do something for them? Is Botox the mainstay, or
Yes.
can you tell us more about it, please? Thank you, Pallavi.
So the two branches of rehab, Cyril, one is pediatric, other is adult, and the gray area is transition rehab.
Yeah.
So, you know, when these kids are young and they're going to a children's hospital, they get full attention, but when they're adolescent and they're transitioning, I think that's the part very difficult in management. So I do look after those transition cases as well as adult spasticity cases. So I run a clinic where it involves assessment of hypertonicity, and then I do procedures with botulinum toxin
All
as
right.
well. So that's part of it.
So you must be very busy. What hobbies do you have? What sort of activities do you like to do apart from work?
I love cooking, and I try to stay healthy. And I think as a rehab physician, I cannot leave without saying a thing about exercise. So that's one of my passions as well, diet and exercise. I love dancing as well. So I'm a trained dancer from India.
Bollywood.
It's called Bollywood now, but I think we trained as classical in Bollywood at the time. So I love doing that too.
That's really good.
And of course, do a little bit of bike riding. I'm not saying I'm an avid bike rider, but I try to.
And it all depends on how much time you have,
Yes.
what other activities, what other workshops are planned over
Yeah,
the weekend.
yeah.
Dr. Pallavi, what
I want to ask one question before I forget. So when you raised a good point that you're not treating just the patient but the family as well. Can you please tell us viewers a bit more about what family support you are giving children transitioning adolescent age? So it can be very stressful on the family, you know. Yeah.
It can be, and I've worked with young patients with brain injuries, and it's very overwhelming for these families to go through emergency, then ICU, and then come to rehab. The kids or their families, you know, they're always worried about how they're going to go back to school, how they're going to go back to university, and
Yes.
what sort of support they might require. Will they go back to driving? Will they go back to activities they love? You know, to sports. So it's about education. It's about also managing, you know, their psychological condition. So we have a big support for, you know, from psychiatrists and psychologists as well. But at the same time, if the family knows, you know, that they will have this rehabilitation support throughout the journey, and we will have regular follow-ups through our clinics, they feel at ease. And particularly, you know, as I run the hypertonicity clinic, they know that they can come back. They can also come back to a general outpatient clinic, whereby I can assist them further and guide them in the right direction later.
And also people who have disability or a new onset disability, the psychological help to help them accept their new normal. That would be a journey as well. And you as a rehabilitation physician would see that. Some with really good outcomes and then some where they continue to work on it.
Yes, it's really very gratifying to see that outcome. And you know, with NDIS, you see a lot of people with disability, and you try to decrease the impact of disability as much as you can. So
Yes.
it's very gratifying to see the other spectrum before,
As well.
you know, they get followed up by the regular doctors.
Yeah,
Yes.
with NDIS, it's like every Australian counts,
Oh, yeah,
opportunities,
yes,
but we need
yes.
specialists like you who are highly specialized in such areas, and the information which you provided to us is so gratifying and good for the viewers too.
What public health message would you give to our viewers?
I think people need to know a bit about exercise. I think a lot of our population think walking is the best exercise and that's the only exercise. I think we need to do variety of exercises. So do something for your cardiovascular health, do a bit of aerobic, then do a lot of strength training. So you could do like your own body weight or do some weight training exercise, not only for your bone health, but generally improving strength as well. Do a lot of flexibility exercises. So stretching is important as well. Do your warm-ups and cool down before you do the strenuous exercise. Yoga, Tai Chi, for example. And they also help in what we call as balance exercises. So have a range of exercises. Just don't think if you're going for a walk for 30 minutes, that's sufficient. Have a variety, and particularly for youngsters who are making New Year resolutions and just, running on the treadmill, that's not very ideal. So start low, slow, and then improve it. Because I've encountered young people with arrhythmias or irregular heart rates when they jump on the treadmill and they start running on full speed. Don't do that. So develop a variety of exercises and go with it. And if you can't do it yourself, have a supervised training.
That's a very good message, very informative, especially what you mentioned about the younger people, that they really focus on building up muscles rather than focusing on general fitness and health. Thank you, Dr. Pallavi. It has been an excellent talk, very informative, a very good talk indeed. Thank you for coming on to this show.
Thank you for having me.
Dr. Pallavi Bansal, thank you for highlighting and explaining and delineating a lot on your area of specialty rehabilitation medicine and the take-home message on lifestyle strategies towards good mental and physical health. On behalf of the doctors of the Indian Medical Association of Queensland, thank you so much, Dr. Pallavi Bansal.
My pleasure. Thank you.
Thank you.
So there you are, ladies and gentlemen, another episode of Aapki Sehat presented by Indian Medical Association of Queensland. And with that, we'd like to place on record our special and sincere thanks to Dr. Cyril Fernandez for putting this together and all the participants coming up on the show and discussing some of those very, very vital and very important messages. As in today's one, the rehabilitation, that is very, very important. And of course, looking at so many different ways and so many different aspects of exercise, not only one. So, there were some very good points right. So, ladies and gentlemen, until the next episode, it's goodbye from us.